topic of presentation is efficacy of saliva for detection of HIV antibodies. So it's a HIV infection which is a major global health problem with 78 million people infected and 39 million dead till date since the discovery of HIV virus. Number of people living with HIV is 35 million and people who died of AIDS is 1.5 million in 2013. And out of this 35 million, 19 million of the people living with the virus globally do not know their HIV positive status. And sub-Saharan Africa remain most severely affected with nearly 1 in every 20 adults living with HIV and accounting for nearly 71% of the people living with HIV worldwide. Number of people living with HIV infection in India till 2013 were 2.5 million, the third highest number of people living with HIV in the world. Prevalence is high in the 15 to 49 years of age group, 0.3%, indicating that AIDS still threatens the cream of society, those in the prime of their working life. Hence, it is important to test all high-risk patients for HIV antibodies in order to prevent the breakouts of this pandemic. So worldwide, the predominant virus is HIV-1, and generally when the people refer to HIV without specifying the type of virus, they will be referring to HIV-1. The relatively uncommon HIV type 2 is most common in West Africa and is rarely found elsewhere. HIV-2 is less easily transmitted and period between the initial infection and illness is longer in case of HIV-2. HIV RNA, proviral DNA and infected cells are readily detectable in salivary secretions and gingival clavicular fluid of infected individuals. Transmission of HIV by oral route is very low or virtually non-existent. The mechanism of this oral immunity is poorly understood. Reports of antiviral activity in the saliva of both healthy individuals and HIV-infected individuals suggest the presence of a factor or factors in the saliva can inhibit the HIV infections. By using sensitive immunoassay in salivary specimen, it is possible to diagnose immunoglobulins against a wide range of infectious disease. For example, hepatitis A, B, and C, measles, mumps, rubella, HIV virus, Epstein-Barr virus, parvovirus B19, human herpes virus 6, and Helicobacter pylori infections. Use of saliva as a specimen for detection of antibodies to infectious agent has generated particular interest in AIDS research community since 1980s. The detection of antibodies to human immunodeficiency virus type 1 HIV-1 in saliva was first described in mid-1980s. Perry et al. In 1987, who described method for detecting antibodies to HIV-1 as well as antibodies to other viruses and proposed using saliva as an alternative specimen for epidemiological investigations. Detection of antibodies to HIV type 1 in oral fluids in large-scale evaluation of immunoassay performance by Granade et al. In 1998. Evaluation and diagnostic accuracy, feasibility, and client preference for rapid oral fluid-based diagnosis of HIV infection in rural India by Nikitapan Pai et al. In April 2007. So what was the interest in the use of saliva? So it's easy for sample collection, reduce risk for disposal of specimen and equipment, potential cost saving, improved patient compliance in research studies, HIV screening program in area where laboratory infrastructure is poor or unavailable, and immediate results are some of the advantages. Oral fluid is composed of mixture of saliva, gingival clavicular fluid, oral mucosal product, food and bacteria. HIV-specific antibodies to immunoglobulin isotypes IgA, IgG, and IgM are readily found in salivary secretions. Although the concentration of IgA in saliva is greater than the IgG, studies have shown that the reactivity to HIV-1 in saliva is due to IgG derived from gingival clavicular fluid. So for this study, modification by in ELISA by increasing the specimen volume, altering the incubation period, reagent concentration, and reducing the assay cutoff values has been made. These modifications have resulted in improved EIS sensitivity specificity compared with those of match serum tests. So aims and objectives of the study was to detect the HIV antibodies in saliva and serum for newly diagnosed HIV seropositive patient by ELISA, to detect HIV antibodies in saliva and serum of healthy individual by ELISA, to compare the sensitivity and specificity of ELISA tests in serum and saliva samples of HIV positive and healthy individuals. Study population consists of the 100 saliva and serum samples were collected from confirmed HIV seropositive subject and 100 age and sex match healthy individual from both inpatient outpatient department of oral medicine, internal medicine, ERT centers. All participants were informed and a written consent were taken along with pre and post test counseling. Exclusion criteria were the patient with a history of autoimmune disorders, for example, systemic lupus erythematosus, or DLE, rheumatoid arthritis, who are likely to give the false positive ELISA test were excluded from the studies. And also the patients who were not ready to be part of study, preclude to informed consent, were also excluded from the studies. This is the pro forma in the English language as well as in the local language also it is there. Whole human saliva approximately 5 ml unstimulated was collected from each of the patient by tilting the head forward and dribbling the saliva from the lower lip into a saliva collector. 2 ml of blood was also collected in EDTA container vacuum centrifuge for 15 minutes, collected plasma and saliva stored at -20 degree until it was assayed for the ELISA test. So this was the kit sample collections, very kit for those. Then testing of samples, saliva specimens were tested by the GenScreen HIV 1+2 kit, which was supplied by BioRed Laboratories. The assay was conducted according to the kit inserts, whatever it is. So this kit was used for detection, and these are the various reagents in the kits for that. And as per the direction of the kit company, that it was, the study was performed. And lastly, ELISA reader to measure the optical density color changes in the samples was used for the readings. And what are the results? Mean age of the study group and the control group was 34 and 31 respectively, whereas most of the study group 57 male as compared to 55 in control group were there, and 43 females were there in the study group. The mode of transmission, 70% in the cases of study group was sexual, whereas 18 cases of blood transfusion, 9 cases of vertical transfusion, and 3 cases of intravenous drug user were there totally. Sexual activity, if you find a heterosexual, 56% of male and 43% females were there, whereas 1 homosexual and bisexual cases each. The antibody detection in saliva and serum of study group, 99% it was found correct in the saliva and 100% in the serum for that. So in discussion, in our studies, saliva and serum sample of 100 confirmed seropositive patients and 100 healthy individuals were tested by ELISA kit. The results were found to be 99% sensitive and 100% specific, except for the one false negative result for saliva sample, while it was 100% sensitive and specific for serum samples. So these were the various studies, and the sensitivity and specificity were also matched with our studies also. And the last study what we use for our reference are the Nikita Pai et al. From India, who she has done in 2007 with 100% sensitivity and specificity of the ELISA kit. Presence of virus-specific antibody in mucosal secretions are well documented. HIV antibodies present in saliva, IgG, IgM, and IgA are there in the saliva. So ELISA test for HIV used to detect the antibodies. ELISA test was modified to make it more sensitive and specific compared with serum test as per the Granade in 1995 and 1998 has used that. This was the age group 57, average age for male and 43. Occupation, if you find that male were laborer and the drivers most commonly, and the female were housewife. Mode of transmission, unprotected sexual practice 70%, and blood transfusion, the another most common causes was 18%. The results were congruent with the study done by Ramirez et al. In 1992 and other workers, including the Nikita et al. In 2007. So in conclusion, the antibodies to HIV can be detected in saliva with almost equal sensitivity and specificity in the serum. Hence, saliva can be used as alternative to the blood for detection of HIV antibodies, as saliva collection is painless, non-invasive, inexpensive, simple, and rapid. And salivary antibody testing may provide better access to epidemic outbreak, children, large population, hard to reach risk group, and may thus play a major role in the surveillance and control of infectious disease. Thank you very much for patient listening. I thanks the organizer for giving me the opportunity to present the paper here. Thank you very much.
Any questions, please?
Why did you use EDTA in saliva specimens?
Pardon, sir? Pardon.
I don't think he heard you. A little bit louder.
Why did you use EDTA in saliva specimens?
No, EDTA, that was used for the blood samples, sir, not for saliva. Serum, I tested serum also and saliva also for comparison. So EDTA was for the serum. Yeah. Thank you.